I'm here with Marc See, who's a physiotherapist at Frontrunner Sports in Perth, Western Australia. He specializes in particular in working with runners, although he's treated many athletes with a variety of injuries. He has conducted over 4,000 clinical gait analysis assessments, so he knows runners very well and their movement patterns. And he's also a highly accomplished runner himself, being one of only 7 runners in Western Australia to run a sub 4-minute mile. And he's also got 10 state athletic championships to his credit. Thanks for taking the time to speak with me, Marc.
Thank you, Les.
Maybe you can talk a little bit more about your background, your training, and also the work that you do at Frontrunner Sports.
Yeah, I mean, here in Australia, most of the time the undergraduate degree for physiotherapy is 4 years. So I went straight from high school into a 4-year degree and came out with a Bachelor's of Science in Physical Therapy. So I didn't need to do an undergrad that is common in some other countries. And we're quite lucky with the program here in Perth with Curtin University where I went. It's very highly regarded across the globe, and we get a lot of international athletes that love to come down and spend a semester or the whole kind of graduate degree with us. And it's a lot of fun. And I graduated at the end of 2010. And so I've been 9.5 years working as a physiotherapist, mainly around running athletes and endurance athletes. So triathletes, runners, long distance athletes mainly. But we do get the whole plethora of people coming through with football injuries. So AFL is a big thing down here, Australian rules football. And it's a bit different to NFL you have up there, but still impact injuries and knees and all the normal things we go and deal with. Plus sedentary athletes who are trying to go into a bit of small activity around their working life. So we get a lot of people that work in the city and will try to go and do a bit of ultimate frisbee on the weekends and twisted ankles and sort like that. And so we get everything, but mainly dealing with a lot of running athletes, which is a lot of fun because I'm a bit of a runner myself.
Yeah. And you mentioned that you're treating, individuals at a variety of levels. Would you say some of the challenges that the sort of weekend warrior runner faces are similar or different to the high performance competitive athlete, or are they similar?
It's amazing kind of the change we go and get of athletes. Usually it's those who are just getting into the sport, who don't have a good tissue tolerance, that get injured quite readily. The people that have been going regularly running for a few years and they're not changing much, they're pretty safe a lot of the time. So we've got a bit of work going on for everyone drilling, that kind of stuff.
Just some ambiance.
Useful for that. So I was trying to see if I can stop that and they can go next door for the other permit I'll put in. But there is a bit of a kind of a curve that you go and see. The injuries in the early runners are quite high. And then those have been going at a steady rate for a while, don't get too injured. And then the elite athletes pushing their bodies to higher and higher demands are where we might see another recurrence of high injury rates. Yeah. So it's a similar kind of level of places that people get injured. It depends always on kind of the distance they're running. For people going for much more kind of marathon running, they're not going to strain a hamstring as a sprinter would. They're going to go and get a lot more overuse injuries. And so it's always looking at where things are going to load up. You have to have that background knowledge of what's going to be predominantly kind of quite sore. And then also just, the recreational runners are a lot of fun because some people come in saying, I don't run much. And they're saying they run 7 days a week. That's a lot. So it always depends on their own perspective, who they are and what they think.
Yeah, sure. And in terms of kind of some of the challenges, I guess, maybe psychologically, are they similar or different in terms of athletes of different calibers or levels?
It's amazing where we can go and get people who are only just getting to running for the last 2 months, but they fall in love with it and their identity switches to being, I'm a runner. And they are as hard to deal with, as motivated, as dedicated as some of the high level athletes, because the high level athletes might be being paid, they might be on a contract. And if they aren't able to compete, it's actually a very big loss for them. They actually have a lack of income. Versus the recreational runner who can still do their normal job, but they want to be a runner. They're trying to go and do this new thing. And so for a lot of people, it's depending on how much it crosses over into them being identifying themselves as this athlete,
Right.
and how much not being able to kind of perform at their normal level impacts on their daily well-being.
Yeah. So would you say that for those who highly self-identify with the athlete role, does that impact their ability to cope with the loss of their training or sport?
Yeah, the grief is much higher. They have a lot more kind of to lose almost. They don't want to go and focus on cross training or kind of focus on your work, focus on your kids for the next 2 weeks. They have such a big tie-in for their mental health or their kind of their identity or their friend circle doing that sport that it's very hard for them to let go, even for small time periods. You
Yeah.
ask someone to have 1 week off and they don't want to do it.
So I would imagine for the high level athlete, you mentioned maybe the individual who's earning a living performing their sport, that identification with the athlete role could be quite salient or quite high. Would you?
It's a difficult thing, and especially now with social media. If you're getting people who are normally, giving you 500 kudos a day on Strava, and all of a sudden you've got a blank day that you didn't run, or there wasn't a workout that you posted onto Instagram, that again becomes very noticeable. You go back a couple of decades, and if you did run for a week, people wouldn't know if you're a professional athlete, because it's not as easily readily available for people to go and see what you did 5 minutes ago.
Yeah.
So the hard thing is there's nowhere to hide for some of the elite athletes now. If you have to be very prevalent as part of your contract, posting daily, posting weekly, and all of a sudden there's no movement, it's quite hard to go and then post, oh, here's me in the gym doing a small rehab session or cross training. It's good because it does give some people opportunity to say, hey, I'm human. I'm just like you, I get injured, and they can interact on that level and have a new platform to discuss with some of the consumers to work through. But at the same time, it's very hard for many athletes to take that line and not just see themselves as that high performing athlete. When they're at a lower level, it definitely is a blow to their self-esteem.
Yeah. So for the high performing athlete who highly self-identifies, then are there challenges in coping with the injury? Or, you mentioned that social media sounds like it can almost be a double-edged sword where they have to, on the one hand, it's nice that they can share what they're doing, but on the other hand, when they're not doing much in terms of training, then there's sort of that absence.
And it's that difficult thing where when the highs are high, they're great. When the lows are low, they're terrible. So social media can pick you up or can put you down. A lot of athletes, when it comes to peak competitions, are turning off social media. Before an Olympics, people go and have a 2 week prior blackout. They don't know what the competitors are doing. They don't want to know that people are putting too much pressure on them to win, to lose, to do something. So a lot of people are doing that for competition. It's hard for them to go and do that when they're injured. Because they want to have that source of actual kind of say, I'm still here, I'm still part of this environment, or they want to check out what their friends are doing and live vicariously through them. Mm-hmm. So the difficult thing with injured athletes is managing that aspect, but also it comes to the other stakeholders. You've got to talk to the coaches, you've got to talk to their manager, the agent if they have one, and make sure that everyone's identifying how long the road is going to be back to recovery and the steps to take, and returning to training versus returning to performance are two different markers. If you don't have everyone realizing what the short-term goals, the long-term goals are, someone might give unreasonable expectations and the athlete will latch onto that. They're going to listen to the person who gives them the shortest time span to get back to feeling normal. They're not going to listen to whoever might be correct. They listen to the best viable option for them. Yeah. And so they may overstep things and start doing rehab exercises that are too aggressive, or they may be kind of doing things that they're not ready for yet. So the difficult thing is make sure that everyone's singing from the same hymn book. Everyone's kind of on the same page and knowing that we've got a journey to go through and we need to make sure that everyone's identifying what happens. And we're very, very fortunate here with the coaching staff and the health team that we have, where if someone's injured, it's okay, the coach backs off and lets the physical therapist take the driving seat for the rehab program. And once they're back to a certain level, the coach and the physical therapist will interact equally. And then it's slowly a gradual process when the coach takes back over. So it's usually around pain and performance when someone's back to 75% their normal training volume. We'll go and look at that in a measure of intensity and volume, or just physically how they feel for recovery. We'll go and make sure that they're at that point before we let them go back to fully being kind of managed by the coach.
Yeah. So you mentioned a number of things there, Mark, and one of them was expectations. Maybe you can talk a little bit more about the role of athlete expectations and its impact on recovery progression or timelines.
Yeah, it's a particularly tough one now because information is so freely available. People can do a quick Google search and look at the latest research. They can have access to it, or they can look at a blog by a couple of specialists talking about time frames. And it's always hard to still be sometimes the expert in the room when sometimes they might have new information you haven't seen yet. And so you've got to make sure that they're having adequate kind of access to good information and not misinformation sometimes. Yeah. And the timelines are kind of what you both expect. So athletes always want to come back quickly and want to come back aggressively. They don't want to hear that a stress fracture takes a minimum of 6 weeks to get back some decent weight bearing load. They want to know, what can I do within that time frame? And, is there a drug? Is there a program I can do to get quicker, to get things kind of back to normal? So you need to go and give them a bit of hope. And there's wonderful anecdotal stories of collegiate athletes in America who will do 6 weeks of cross training on an Alter G and still get back to indoor championships and medal. So it's amazing to go and have those stories and teach people that, look, you might be able to do your normal training. We can modify it. We can get you doing some gym-based work. We can get you doing aqua jogging. We can get you doing other modalities to still keep some loads. And you manage the expectations, saying you might not train as normal, but you will be able to train to the same intensity through different modalities which don't load your tissue. Right. So a lot of times it's about the timeline and managing expectations about normal training.
Yeah. So it sounds like a bit of a balance between, you said, giving them hope that, progression is possible, but also managing those expectations so that, they're not overdoing it or sort of trying to push the boundaries too much. Is that right?
It's a difficult line to tread. If you give them too much bad news, the athlete becomes depressed, and then you lose them altogether in part of the process. And they say, well, okay, I'm just going to go and start drinking. Life's not worth living. I'm just going to kind of be very depressed and pull myself away from my friends who are also other athletes. Because a lot of athletes find that they don't want to go to training. As an injured athlete, you don't feel part of that circle anymore. You don't belong because you're not able to train and able to participate. So you won't go down and hang out with your friends who are normally kind of doing that sport. You feel guilty for being around them because you can't participate.
Is that a good thing or is that a bad thing? Oh, sorry.
It's one of the worst things, because if you don't have that social network, other people can go and say, look, it's okay, still be here. We're still your friends. We're still getting that kind of good social contacts. It's always going to be hard for someone to cope. So if you have the expectation that you may not be able to kind of participate in training, but you can still be there and be an assistant coach for a month, go down and help out the team. You've been there in the mix. You know how they move, when they're feeling sore, when someone's not moving right. You can have that better insight to help the coach. So take on that role and be part of it, and don't make it all about your own woes and your own kind of issues. You can still help your teammates, your friends, and kind of they'll get a kick out of it as well, that you're actually still around and haven't just hidden in bed for a month. So you'll actually be more positive about it, and you'll not have that ache in your gut because you're missing the training circle, which we do to some extent.
Yeah, and so
trying to manage that.
So by assuming some of those other roles, like helping the coach or with analysis, does that also help the injured athlete themselves in addition to their teammates? Or
yeah, because it also makes them reflect on their own movements as well. So they can go and say, well, I'm seeing this person move like that, and okay, well, what do I do then? So they have to go off a reference model, and usually our own reference model is either what we've seen from other people or we've felt ourselves. And athletes are very good at that kinesthetic awareness. They know their own bodies very intimately. So they'll try to mimic something for a friend and say, look, you're doing this with your hips, can you do that? And it gives them that better insight to their own movement pattern as well. Yeah. And if that's part of the chemistry of their injury, they're getting better associations between, oh, that's right, I was told I'm doing this movement pattern, and so can I change that myself? So it's a good way to get that, extra bit of analysis of a friend and help out that reflectively working to yourself.
Mhm.
But also just, keeping them involved in the training circle to make sure they're not getting too isolated and depressed. So definitely coping. We all do better as social creatures, unless you really feel like it's just too much pressure, and then by all means have a bit of time off. But most of us do feel a bit better when we're around kind of familiar friends and faces.
Right. And so does that help with the identification piece that you mentioned, kind of still being part of the group or the team?
Yeah, it's not that individual thing where, okay, I'm an athlete, I'm still competing at my highest. It might be, okay, I'm an injured athlete, but I'm still around other people, other peers that know me as that person. They know I'm down for now, but I'm not out. I'll be back, and usually get that good reaffirming kind of vibe from your friends. If you get some people joking around saying, oh, you'll never be back, I'll take your spot in the team. That's not always helpful, but it can be for some people quite motivating. A lot of athletes need that drive, need that combative pattern. So if they see someone taking their slot in a team or in a position that they feel is theirs, they might be more motivated to get back and say, no, that's my place. I've earned that from the hard work I've done. I'm going to do more hard work now and get back. But it does depend on the individual athlete who you want to target that line of thinking, or if you want to just have them there and just participate and make sure they're still feeling they're involved.
Sure. Maybe you can speak more, Mark, about the role of motivation in injury recovery.
It's a tough one because a lot of athletes are highly motivated to get back to their sport because it's a big part of our identity, our mental health, and a lot of people don't feel the same. If you play a round of golf every fortnight with your buddies and then you're missing that because of a back injury or a knee injury, you want to get back to doing that because it's a regular social circle, it's a normal thing you want to do, so you're quite motivated. And a lot of time, we don't need to force motivation on a lot of people that we have to go and treat. There's already a story. As soon as they start talking about what happened and the exercise they were doing that caused the injury or what they haven't been able to do because of it, you already pick up a few cues straight away that, okay, that's something I want to get back to. Or just a simple kind of couple of questions about what are you missing most. It's trying to find that, and that makes part of your treatment program saying, right, we'll get back to that kind of small point. If it is, for some cyclists, it's just having a coffee with their friends. That's the reason they cycle. They'll do a 60-mile ride just to go and have a coffee at the end of it. Yeah. And so you can say, right, let's go and make it a bit easier. Let's get you doing just 20 miles, meet in a coffee shop and start back there. They're working that. So you find the motivation whichever way you can.
Right. It's a lot of torture just to get that coffee.
And that's the thing. Some people, that's the whole reason they do it. It's not about the ride. It's about, gas bagging with your friends afterwards, sitting there in public in Lycra and just kind of feeling like, okay, this is my Saturday morning.
Yeah. So would you say that you're asking questions that elicit insight into what the person's motivation is to engage in their recovery or rehabilitation?
Yes, it's a lot of open questions to ask people, what are you missing? What do you want to get back to? What is the number one thing you need to achieve in the next month? And asking those small things. And it's helping lay out that stepping stone for them to get this kind of working. And especially when it comes down to some of the later stages, for people getting motivation when they've built up a solid foundation of basic training load, saying, right, getting back to competition, what do you need to tick off? What are you feeling like we haven't touched on yet? And the athlete will actually sometimes tell you something that you forgot. They're going to say, if they're a multi-directional athlete, they're getting back to football, saying, right, I actually want to practice some tackling. I haven't done that for 8 weeks after a knee injury. So I feel like I can't get back out in the field and absorb a tackle. I'm scared. And so, we missed that. Great. So the athlete starts to take over the reins at some points, and you are there just kind of helping guide them once they find the direction they want to work into. So that's usually a good thing for heading back to some of the return to sport versus return to performance. Return to sport is always a big indicator that people look for. So returning to, generally that's training. It's just getting back to a training session. That's return to sport. That's to a lower level. return to performance is the thing we need to aim for. Physical therapists usually good at getting people back to about 80% capacity. There's a big margin getting back to where they were or where they want to be. You still got to get that kind of high level point. It's making sure that you fill that gap, because the athlete, if they're not strong in their minds, feel they've done everything they need to do, if they're still worried about the injury or worried about the time they've had off, they may not perform at the same level and they may get a new injury. If you go and get a field athlete who is strong in straight lines, but they're so worried about their own kind of mechanics, they didn't see a player blindside them, they might blow out an ACL, which is going to have them out a lot kind of longer than the hamstring injury they saw you for. So it's all those small things, making sure that you get everything back to performance and not to return to sport.
Right. So you make that distinction on several occasions, return to training versus return to performance. Yeah. And you also mentioned, Mark, there's kind of a gap between those two. So like who is responsible for filling that gap? Like once their physiotherapy ends, what kind of happens with the athletes you see? Or maybe that depends on the level.
Yeah, it always depends on who's involved. If it's a big team where there's a strength and conditioning coach and the actual overall head coach, they definitely take over to make sure that athletes, going back to maybe they had pre-season baseline of their back squat and their 30-meter sprint, and have to get back to a certain percentage of that before they know they're comfortable to return to training and return to full-on performance. They have to complete a certain number of minutes of high-intensity sprinting in a training week. There's big markers at higher level sport to get things kind of working. We know the data, everything's available, coaches know what they want to see to avoid re-injury, because a lot of re-injury happens in the first 3 weeks and back to performance and back to training.
So it happens when, did you say?
In the first 3 to 4 weeks.
Yeah.
So you can re-injure things. As soon as you get back to that higher training load, if you weren't prepared, it gets difficult. The hard thing is going back to the lower end of the spectrum, where it's a weekend warrior who's just, playing mixed netball or softball with their friends once a weekend, and they've come back from an ankle sprain, and you've got them balancing on one leg okay, they can kind of hop, but they haven't tried too much more than that. And then you go and get them trying to be on their feet for a 3-hour softball game and rounding corners and sprinting and changing directions. And if you've had them hopping on the spots, you may not prepare them adequately for that level. And so you need to make sure that you've given them good guidance, you're catching up enough to make sure that they can play a full game and feel adequate through there. So it's really a big thing to go and manage some of the expectations across the spectrum, from some of the recreational athletes to the high-level athletes. There's usually a disparity in the actual information we have available to see what's adequate to get things working and how easily the athlete understands what they want to do.
Yeah. So would you say, though, regardless of the level of the athlete, that it's important or valuable for them to sort of appreciate or realize that there's a difference between being ready to return to training and what it means to be ready to return to performance?
Yeah, definitely. And the thing we deal with mainly with runners, and we have to tell them that training is training, racing is racing. If we get you back to doing a training session, you may have to pull back on your speeds, paces. So doing mile repeats, you might not be doing them in 6-minute miles like you were 5 weeks ago. You might be doing 20 miles to get that done because you're not the same fitness. Mm-hmm. And we don't want you trying to run at 6-minute miles, because that might be overextending yourself and you'll be racing in a training session. And by the same token, if you were hoping to do that fun run that was coming up next month, okay, we need to adjust your expectations. You won't be going for a PR. You have to pull back and say, right, I'm just going to get there, practice my normal routine of warming up, getting through the events and participating and working through it all. So if you get someone back to training, you make sure that they're still getting through a decent training load and a normal training cycle, whether that's a 4-week training cycle or longer, to understand how they're adapting back to that normality, how close they are to pre-injury levels, and when they can get back to being competitive, working through things. So it's always a hard thing to indicate that, yeah, okay, I'm happy to get back to normal training levels or reduced training levels, but then still talking about, okay, but what's the next goal? So we'll get back training, great. We can increase back to normal training levels, and then your next event, your next game is coming up. How do we get you through that without injury or without scaring your body? And then when can we go and say, yep, I'll kind of let you go hell for leather. You can go and do whatever you like. It's unleashing them once they know they're comfortable. And sometimes that's subjective from the athlete. They will tell you, I feel ready, I feel confident. And you can put them through a few objective tests. You can make them run, sprint, change direction, do a couple of outcome measures to know that you're happy with the numbers. But if the athlete at the end of it still says, I don't think I'm ready, it's end of the day, it's their body and they're in control of it. It's their mind which gets to go and steer the ship. Yeah. And if they're not confident, they won't move normally. They won't intercept a ball that's just out of reach. They won't reach for it. They won't do the normal things they would. And they may, injure themselves because they're too cautious.
Right. So what causes that apprehension for the athlete who's trying to return to performance?
It can be either just a limit of exposure to that trained stimulus for some people. So like incident I said before, the tackling for a field athlete. If they're doing rugby, if they're doing American football and they haven't practiced actually having an opponent in full gear running head on at them, they might be scared because that instinct kicks in for a lot of athletes who've been doing it for years, but it gets blunted if you haven't used it recently and you're worried about protecting that injured site.
Right.
So make sure they're quite comfortable. For some of the high-level rugby players down here with rugby union, rugby league, some of the physical therapists will actually get them practicing falling from a height. So if you actually get picked up and thrown down by an opponent, kind of a spear tackle, it's not great to see that done in a slow motion. It's quite terrible to watch. But for someone who's had an overhead injury, they've had an AC joint injury, you got to practice falling onto their arm. If you've only practiced doing some light bench press or weight bearing, it's quite hard. So some physical therapists will get them to do a handstand and then take away one arm and roll into a ball and fall. Mm-hmm. And you've got to practice that to know that you can roll that movement to get into those weird postures that you haven't done for a while at the speeds you need to as well. Yeah. And then do that a number of times so you know you can roll and confidently get through that movements and make sure you can adapt. So it's exposure to that stimulus and then making sure that you built up to it gradually. You haven't just gone, oh, we've missed that aspect, let's go and try it now. You're going to have those stepping stones to work through it. Right. A lot of the things that athletes do are skill-based and you forget that. They've had thousands of hours to practice and hone that skill. And if they've missed it for a while, they might be a bit rusty. And so you make sure they have adequate time to practice and get back to their normal patterns, their normal speeds to make sure they can do it well and not have to think about it. If they're not autonomous, if they're having a part of their consciousness think about that, they're not thinking about something else. They're not thinking about the opponent coming at them or where the actual own goals are sometimes. You can go and get a field athlete that runs the wrong way because they're worried about the person next to them and their own knee. They forgot that they were that kind of side to go and hit the goals rather than going that way. Yeah. So small things can change.
Yeah. So what happens, you mentioned the importance of exposure and also the gradual progression in building that confidence or efficacy to return. Mm. What happens if there's inconsistency between the ability to do something gradually and the need to return in a certain time frame, given the point earlier about expectations and time?
Yeah, that's always a hard thing. When there's, when it comes to the playoffs, if there's a need to go and get that kind of player on the field to get things working, you have to go and say, right, okay, but you might not be able to handle a few minutes. So Netflix had the Jordan documentary recently on, and for a while after his foot fracture, they would let him only play a few minutes of each game because he had an navicular stress fracture. And they were limiting him just to make sure that he just did enough to not damage his body. And you can do that. You can say, look, we'll still get you to go and play. You'll be a part of it. We need you. But we're going to modify the risk by pulling back on the exposure you'll have to that high stimulus where it's uncontrollable, it's very intense, where it's very difficult. So you can still get someone to participate at that high level, but you can modify their risk by having limited exposure to work in. It's easy in team sports. You can substitute on and off. For someone trying to run a marathon, that's very hard to go and say, all right, we're going to get you still going to that marathon, but you can only run 20 miles, not 426. It's not going to work. It needs to be a reduction in pace, reduction in expectations, or you downgrade them. Is there a half marathon option that day? You still get them running at the same intensity, but go for a half marathon PR, which might be more achievable than running the full marathon. So sometimes it's just trying to hedge your bets and say, yep, we'll still go for the same goal time, but we might reduce your level of actual participation and expectations of what you're going to do on that day.
Yeah. And you mentioned kind of expectations again in terms of the
Mm.
return to play and sometimes just modifying the expectations about what the athlete is focused on or what they can hope to achieve. Would you say that there's sometimes unrealistic expectations that the athlete's like, okay, I'm going to get back in and be a world beater right at the start? Or
yeah, always the time frame is the big elephant in the room that no one wants to talk about. So generally, we can do amazing things now in health sciences, but the body still heals at a certain rate. You cannot increase it that dramatically. If someone has a large calf tear, you are not going to get them participating in a tennis tournament that weekend, possibly. By the change in direction, the power they have to go through, and things just take a certain amount of time to get right. And so you've got to almost, we map it out for them, looking at, normal healing times are this, to and line out what normative is. Sometimes high-level athletes have amazing capacities with their tissues to actually heal faster. They've got a better vascular bed, high oxygenation of their blood. They actually can heal faster. Generally, they have more time to recover. They sleep a lot better. Things are going to change around. So you get someone working 40 or 50 hours a week and they've got a calf tear versus a professional athlete who just spends 12 hours a day in bed, they're probably going to heal quicker. So it does depend sometimes on their sedentary nature or their physicality, what they can go and do and how much time they have to spend off it. If you got someone in hospitality who's working in a bar and they're on their feet and they've got plantar fasciitis, plantar heel pain, it's going to be hard for them to not be on their feet. So how do you modify that versus someone who has been more of a desk job who can put their feet up and be comfortable during their day? So it's always managing those expectations about what can we do to help reduce the irritation of your tissue, increase its capacity to actually heal without being stressed. And then also looking at that normal kind of distribution of healing time. Some people heal slow, some people heal faster, but most people are around about here. And where do you slot in that to get things changing? There's a lot of information coming out about people with genetic predispositions to inflammation. So maybe they might have a more unbearable environment to actually healing if they are highly inflammatory. And so you need to modify that with extra modalities if you need to get them to a better point where they can heal. Otherwise, they will be slower to recover.
Right.
And so it's amazing. Still, we're learning so much about the body and that healing. So it's just trying to keep up the research is difficult for many clinicians, but also they're conveying that on to anyone that you're dealing with in lay terms that actually makes sense to them is also quite a trick.
Mm-hmm. You mentioned differences in healing. Maybe you can talk a little bit about pain and the role that it plays in recovery.
Pain science is a massive quagmire. It's hard to kind of sift through to know what we know and know what we don't. There's so many things to go into it, and we are really underprepared in many undergraduate degrees to understand the role of pain. The biopsychosocial model that's taught here in Australia for much healthcare is looking at, understand the biology, but also the psychology and the social aspects of what the injury is going to do to someone to work through this. We try to work on everything to work through it. They all have influence on pain. If someone is not able to perform their daily tasks of actually looking after their family, looking after their children or anyone in their care or do their job, they're going to be highly wound up about that injury. It's going to make much more impact than if they was looking after their own body and they could sit down and let themselves recover. So the stress that's involved is highly, highly detrimental to pain levels and also recovery times. So that's an amazing thing to go and look at how much you can affect yourself by your mood and by your own expectations about your pain. Get this one change around. So it's amazing to see the change we have there, but also just educating people that pain doesn't have to mean that tissue is being damaged. So a lot of people are very hesitant to load themselves with, especially things like now the big thing everyone's looking at is tendon loading. So going heavy, slow resistance, and people are scared to go and put 40 kilograms onto a Smith machine, do a single calf raise to help with their Achilles tendon because it's a bit sore. And you get them doing one set of 8 and they say, oh, it's a 3 out of 10 pain. I don't like it. It might get worse if we do another one. And it's like, okay, we'll stop if it gets worse. We'll try another set. And then before you know it, they're like, oh, the second set was a 1 out of 10 pain. That's great. It's getting better. And some tissues actually respond better to load and they feel more pain-free with it. But people still get very scared about pain. And it's a hard thing to go and actually let them know that pain is just a signal. It's creating your brain to go and tell yourself that tissue is under stress, that it may not be able to handle, and don't keep repeating the exercise because it may be detrimental to the body long term. But if you manage that and go and say, well, we'll trial it in different ways, we'll modify it as we can, you can kind of get around things and make sure that pain is a great check engine light. I mean, if we all didn't have a check engine light in our cars, we might be bottoming out and blowing up the engine a lot earlier than we would if we had that signal. Yeah. So the same thing we have with pain in the brain, to go and let you know that don't keep doing what you're doing, it's going to be bad, and make sure that, yeah, you respect it, but don't be too frightened of it. It's always a lot worse for some of the wonderful case studies out there of people who have a very, poor pain sense, and they end up getting fractures all the time because they fall from height and don't know about it, try to walk and fracture a leg and never heal and things get worse. So pain is a very useful evolutionary tool. You need to respect it and be thankful for it.
Yeah. So would you say that there's an important aspect of educating the patients about the meaning of their pain and helping them to distinguish, what's benign, what's more sinister, or,
yeah,
what's
definitely. And it's always hard to tell someone that the cliche that it's all in your head. Well, actually, it is all in your head, your pain. There's local tissue damage at the superficial level, but what's happening at your spinal cord level and up at your cortex is also very influential on it. So you can wind the pain up or down depending on what's changing.
Yeah.
And the normal things you look at are always at the local tissue, to go and apply an ice pack to numb the area, or do a bit of soft tissue massage to reduce some local tissue tension. But everything that goes up to the higher level of, okay, how's the person's mood when they walked into the clinic? Are they anxious? Are they scared? Have they just come from an exam? If they're students, are they really kind of worried? That's going to make them a lot more adept to notice their pain than if they're relaxed. They've just, had a great day. They've been out at the beach. The sun's been shining. They've seen their friends. They come into the clinic and they're going, oh yeah, my foot pain. What foot pain? It's a good day. The sun's shining. Life's good. Yeah. It's going to change depending on how they are. So letting them know that the pain will fluctuate and that it might not always be linear, the response it has to activity, depending on what they've done the past 24 hours. It's always that hard thing. Like going back to tendons, the latent pain effect, where you can load up a session and feel amazing for that track meet. That track meet that you did, no pain, my Achilles, I was fine. The next morning you can't walk. So letting them know that you might not feel pain at the time, so don't feel like you're bulletproof, you're over your injury. We need to know what happens 24 hours later. So it's always looking at the pain magnitudes, the pain timing, educating them about normal behaviors of their tissue, what we expect to go and see, to feel, and to see any progress in, is quite difficult. So it's usually looking at a lot of research, what happens, but also your own clinical knowledge. As you've seen more and more cases, you get to know what happens. And even for instances, for me, I'm quite lucky with some of the injuries that I've had, where I can articulate that to athletes, talking about the descriptors behind the pain, talking about what the pain feels like and how annoying it is and how it will warm up. If you can talk to someone at that level, they'll go and say, great, you're not just some cold person talking about pain that you haven't ever experienced. You know about it as well as a fellow person at the same level, you're a peer, which can actually be quite useful for them to go and say, well, okay, I'm not in this alone.
Yeah. So if there are sort of descriptors or adjectives that one can use to describe the nature of their pain, that's helpful in better understanding its meaning, would you say?
Definitely. Pain's very, very colorful. It's got a lot of texture. It's very different. Someone can come in saying they have a cold, iron, stiff pain, or it's a burning, lacerating kind of feeling they go and have, or it's a toothache they go and feel, something different. And that can let you know what tissues are actually quite sensitized in that area, feeling differences between what bone feels like versus what a ligament tear feels like versus just a hot swollen knee. All those different things can let you know, A, what tissue is actually really driving their symptoms, and B, kind of, how you need to attack that. Definitely is going to be part of it. But also, some people are very poor at articulating their pain. They're just going to say it hurts. And so it's always a good way to go and also get an indicator of how in touch with the body that person is. Sometimes if they're at either end of the spectrum, it's quite difficult. If they're too sensitized, they know the body too well, it's going to be very hard for them to kind of, pull back on how sore they are, versus someone who's numb and they don't really know what's happening. You're trying to get them to activate a certain muscle to alleviate the area, and they can't feel the activity. It's always quite interesting working with people at either end of the spectrum.
Yeah. Maybe you can talk a little bit more, Mark, about some of the different thoughts and emotions. And you mentioned a number of things already, like depression or anxiety or uncertainties. Maybe you can talk about some of the kinds of thoughts or emotions athletes have and whether they change over the course of one's recovery.
It's almost the same as the grieving kind of steps. Everyone goes through that little bit of just denial first off, and then they'll go through points of bargaining, and eventually they'll get around to acceptance, to go and do a few things. And it depends sometimes on, have they experienced that pain before? And if they have, it can actually be useful because they have a good expectation about how long it will take. But sometimes it can also be quite detrimental because they know it can take so long. Can't change around. So the emotion of injuries, it again ties into their self-identity. If they are highly addicted to their physicality, their sport. For some people, it's their body image. They don't want to put on an extra 5 pounds. It might be things kind of changing. So that kind of definitely latches into it for how much they feel that emotion, and it changes over time as they start to go and see progress. They'll have less and less negative thoughts and start feeling more positive as momentum gets behind them. So they get more momentum to kind of say, right, I'm getting better. I'm seeing it daily. But sometimes they, have pain for so long that it becomes part of them as well. When you get people coming in who've had an injury for 2 years and they've got a bit of a chronic pain syndrome in the background, it's hard when they kind of see themselves as that person with low back pain. And it's hard for them to see a point where they'll be without that and to kind of get to change. And so they almost have that as part of their identity. And so you've got a whole nother layer to work through. If they're an injured athlete and they see themselves as an injured athlete, you're dealing with many, many layers of things to work around and to try to unravel.
Yeah. So it sounds in some ways like there's some consistency in terms of responses, but also a lot of individual variability. And, you mentioned like people's responses to pain can vary as a function of what they were doing that day, or, maybe their sort of general pain tolerance, or, different factors, I guess, related to their competitive level, or, whether they have support around them in terms of, you mentioned like for the elite athlete, maybe there's a lot of people managing their return to performance in particular. So it sounds like kind of there's this mix of commonality, but also a lot of individual variability.
It's a difficult thing. It's a massive spider web of interconnected relationships for any athlete. You've got to look at the local support network, other stakeholders in their performance. Do they have a coach? Is there, the rest of their family quite ambivalent towards their kind of their goals? If they don't kind of really mind if the person's injured or not, it makes a difference to them. They haven't got a lot of support from their family. Say, we want to get you through this because we know you love this exercise. Is it a young athlete who has a lot of pressure from a parent to kind of get into, the next level of Little League, going up a grade, anything through there? It's amazing to see some of the external pressures, how much that changes your expectations of your own performance and kind of your injury and whether or not you actually want to get better sometimes. People can sometimes want to stay injured because it's less pressure. You can go and get athletes that are getting bored or getting sick of their sport who may not want to get better, and so they purposely aren't coping
Yeah.
through things. It can be quite amazing to see that sometimes.
Yeah.
But
Would,
it's
would, would you
tough.
say that those external pressures are detrimental, or again, is that sort of case by case?
It can depend on the person. Some people like that pressure. I mean, for many high level athletes, pressure and time makes diamonds. You get some of the highest performing athletes who need that argumentative nature of someone constantly testing them, saying you're not going to be good enough, you won't get back from this, or you can't make the next cut. And they're going to say, no, I'm going to train my butt off and I'm going to prove you wrong to get this done. Or my body's letting me down. This isn't good enough. I'm better than this. I'm going to do everything I can to get back to it. It depends on, that internal motivation sometimes. And it's amazing seeing some of the athletes that come through on all levels. It doesn't have to be an elite athlete to go and do it. It can be someone who's just really good at knowing their body and saying, no, this isn't me. I don't want to be this person. I want to be back to where I was, and they'd be very motivated to get back there.
Yeah. You mentioned support, and I'm wondering if there are certain kinds of support that athletes need in their recovery or that they really benefit from.
Yeah, it's good now that mental health doesn't have as much of a stigma as it has had in the last decade.
Mm-hmm.
So athletes actually seeking sports psychologists to go and help work through an injury they've had for a long time, or they can't get another PR. They've been trying for 3 years, haven't been able to do that. Is there something they can go and change? I've seen a sports psychologist myself when I was younger to kind of help battle through a few things. It's good to get that working. And if we can actually get people to understand that there's still so much of the brain we don't realize its effect on us, and if they can latch into a few things, can really help out. So making sure that people don't feel the need to shut off and say, no, this is my problem, I'm going to deal with it. They can actually talk to other peers who've had a similar injury, or the coach who's seen it 100 times, and they'll say, no, it's okay, you'll get through this, people survived it. And making sure that their local network is very understanding. So friends, family, they know that, you want to kind of get back to a high level and they want to be there to support you. You don't want people mollycoddling you and being too protective to go and pep you up too much, saying, yeah, champ, you back next week, if it's not actually a reasonable expectation. But definitely the support, it's a great one to go and look at how it can help people get through injuries. You can have the best medical help in the world, but if you have people naysaying you or not being very helpful to the process, you've got a high study load as an athlete, and you can't have time to get to the gym to do your rehab exercises or get another bit of a massage from somewhere, something extra. It's going to be hard for you to kind of dedicate the time. If you start sacrificing sleep to get into those extra points, it's not going to help out. So there's always other factors that get into it.
Right. You mentioned kind of changing perceptions of mental health more broadly. And I'm wondering if there's sort of a changed view in terms of sports psychology and, the idea that it's not just for the head case, but it's kind of like, well, if you want to optimize your performance or if you want to address the psychological components, you mentioned the biopsychosocial model earlier. If you want to address that component of the puzzle, then it makes sense to speak to people with that expertise. Is that kind of changed that perception, maybe in terms of your experience of sports psychology?
Yeah, it's a really nice thing to see. I mean, any extra aspect of health that people can latch into is great. And mental health is becoming much easier for people to talk about and get things kind of working through. So athletes, we're still all kind of regular people who do go and have the normal plethora of issues that come away from sport anyway. So if you do have any extra kind of mental health problems to work through things, or slight vices that you need to kind of have help with, definitely useful to have someone there to help you manage them, to work through things. But also simple things of goal setting for athletes. Sometimes it's very hard for people who come into a big championship and they achieve what they set out to do, but then there's a big depression afterwards saying, right, well, what's next? They didn't prepare for it. There's a 4-year cycle for many track and field athletes who go through to Olympics and go and say, yep, I got there. I made it to the semi-finals. That was my goal. And then now what? Now what to go and do? It's changing over. There's that big just drop off because they were building up to that one day, that one point, and they didn't look past it. But it's kind of changing and they didn't prepare themselves.
Right.
Even for athletes after their career, if they're looking at, okay, my identity was an athlete. I had this one specialized set of skills I was very good at, and they're not prepared to go and get into normal life, but they don't have that relationship. It's hard to go and get things working.
Yeah. So those transitions can be challenging to cope with, and sometimes there's just benefits getting, input, advice, assistance from credible individuals. Pardon me. You mentioned. Sorry, go ahead.
So it's very much that kind of credible kind of sources to get things working. I mean, we all can be a great sounding board for fellow peers to just go and be, all right, let's talk through some of the issues you're having. Let's just discuss it over a slice of pizza. Go simple. Do that to get things working. And especially, I mean, males, we're horrible. We do not talk about feelings. Do not talk about emotions. Do not talk about bad thoughts. We know we need a social reason to go and do it. Males need to go and play golf or go bowling or go for a jog with a friend. And then after a while, they're feeling comfortable. They'll open up about what's happening at home or what's happening at work, what they're thinking about with their kind of own injuries. So especially with male athletes, they need to still be part of that social circle or doing other kind of sport to talk to their peers and open up about what they're feeling, or see actually a professional who will help them kind of work through it.
Yeah. How does doing that, disclosing or sharing one's thoughts and emotions, how does that impact their recovery?
It's difficult for some people to admit they're human, really. When you put yourself on a pedestal saying, I'm a supreme being, I'm a great athlete, it's hard to go and say, okay, I'm just like everyone else. I am injured, I am sore, I've got issues to work through. But it's also part of that grieving process, that acceptance to go and say, okay, I have this issue, can I get part of it? And making sure that you take ownership of it as an active participant in your treatment. A difficult thing is always when we have passive clients that come in with an injury, saying, okay, fix me. I've come to you for help, fix me. And so you're up against it straight away because they don't want to actually do anything. They will not participate if they don't believe it's their issue to solve. You need to make sure that you meet each other halfway, saying, right, I will help you with your injury to work things through, and we will manage it together to get things working. Otherwise, it's not useful. So they need to admit to themselves they're injured and that they are part of the problem, part of the solution too.
So it sounds like it's important for you to clarify your role as a facilitator, would you say, and their role as the active participant in their recovery. Is that right?
Yeah, definitely. You just don't want the belief that you're going to wave a magic wand and they will become all of a sudden injury free.
Yeah.
There needs to be a process and understanding that it will take time, how long, lay that out, and the role of each of you. And a lot of time it's actually a diminishing role for the health professional. They start off with the priority. They can do most of the hands-on work, set the program up, and then over time they'll do less and less and less as the athlete takes over the role of their own care. And you want to make sure that someone is self-sufficient by the end of it, so that really the best health professionals do themselves out of a job. You make the person so readily available to address the injury next time by either not getting injured in the first place, or when they know they are having that same symptom, what to do, how to recover from it, that you are, not needed. You are kind of out of the equation.
So as part of your role then, or what you see as your task, Mark, to help the athlete self-manage their recovery or to, become, the key actor, I guess.
That's one of the key markers I look for when the athlete starts to go and turn the corner saying, yeah, okay, I've got this under control. And they automatically want to start spacing out their appointments. They don't want to see you in 2 days. They want to see you in 2 weeks. And no, I think I've got this. I'll see you in a month. Let's go and catch up. I'll show you how good I am then. I think I'm almost back to kind of where I want to be. And they know the steps. And I try to get that with a lot of treatment programs. It's very much in the early protective phases. I'm in charge. I'll make sure you're not going to damage your tissue. I'm going to start handballing more and more kind of responsibility to you as we go on. And you get a couple of small outcome measures that they're going to try to tick off, getting back to, being able to achieve a certain marker on a questionnaire, or being able to show that they can jog for 20 minutes without injury. You say, great, you've ticked off that. I'm pretty happy to get to this level. Now you're going to take over doing a bit more work on these aspects. And we're going to meet up just to make sure you aren't overdoing it. And we're going to manage you through this. And when they take that control, it's always good to know that they're using their body. I can't control themselves as well as they can. So if they're going to take over ownership of their own body, it's the best case.
Yeah. How do you know when the athlete is ready to make that return to performance?
That's
what
the million-dollar
signs
question. That's always the million-dollar question to work through. So give me a second. Yeah, we'll be able to get to, I'll be 5 minutes, hopefully with less. There might be some more drilling, sorry.
Yeah, no worries.
That's right.
Yeah.
That's the million-dollar question, to know when someone is ready to get back to full kind of performance. And a lot of time it comes down to that athlete being ready. So them telling you that they want to get back out in the field and they feel confident. And sometimes it's the simple question of, what have we missed? What do you think in the rehab program we didn't do enough of? And if there's any lapses, the athlete has in the back of the head saying, oh, I don't feel as strong as I need to be. I don't feel confident for tackling. I haven't done enough minutes on the field. They'll let you know about it.
Yeah.
And it's that hard thing to kind of know it. So there's a couple of good measures from the research of knowing that someone needs to be at, this measure for a Tampa scale for fear avoidance of activity. We know what we can go and do to get into that level, and you can use some of the markers there. But it's always getting back to just the person in front of you. Do they look like they're moving well enough? Do they feel they are confident to get back out and do their sport again? It's changing over. So that's the difficult thing to go and know. And you can just use your clinical reasoning. Use all the items you have available, looking at what they're telling you, what the research says should be happening. Your own gut instinct is sometimes a good indicator too.
Mm-hmm. So it sounds like it's multifactorial, whether it's observational, what they tell you, your gut instinct, what research tells you about people who are achieving certain clinical or maybe functional markers should be able to do, or maybe risk of re-injury, that kind of thing. Just a couple other questions before I let you go here, Marc. What would you say there are any benefits to the injury experience or upsides to it?
Yes, unfortunately. Sometimes it can foster resilience. You can get someone who was humming along as a bit of a jogger. They kind of weren't too excited about their running. Then as soon as they're starved of that, they realize they love it. And so they will work harder at staying injury-free in future. Mm-hmm. They might work out that they want to actually do more than just their 5-mile lap twice a week. They say, no, actually, I feel like I'm doing not as much as I could. They might want to start trying to take on a half marathon. So sometimes they can actually go and get more resilience or have higher goals. And for elite athletes, it can be great to work on fundamentals. So maybe you haven't gone back to something basic to go and work on, looking at postural stability, or looking at reaction times, or basic kind of skill movements. So you use the downtime you can't do all aspects of training to focus on small aspects you may have missed. It's that normal thing of, when's the last time you sharpened the axe? If you're trying to keep on doing the same workload, but you're actually using a blunted tool because you haven't looked at your own body for a while, go back and look at, okay, what can I improve so when I'm back to 100% capacity, I'm even better than I was pre-injury. Works for those things. So people can come back hungrier to compete and better equipped to compete after an injury.
Right.
So sometimes,
do you notice that some athletes do emerge stronger after their recovery?
Yeah, we've had a few that have done that, and sometimes it is the sub-elite athletes, because they were burgeoning on making it to that next step, and it was taken away from them. So they focused on a few small aspects, got themselves even hungrier to actually break through that next level, and then they managed to kind of push on. It's always just making sure that it's not an explosion of training in the first kind of month afterwards. It's still well handled going forwards, but you bottle that intensity, that motivation, and make sure you drip feed it for the next 6 months to the next 18 months to make sure they are pushing on, saying, look, you were injured, let's not get injured again. Let's use this and kind of come back stronger than ever.
Yeah. If you were to share one piece of advice for injured athletes, what would you indicate?
It's the old cliche of prevention is better than cure. That's the number one thing. So if you can prevent yourself getting injured by managing your training load, is a big thing, and working on recovery. So the sleep, the nutrition, stress levels, working those things. But if you do get injured, be an active participant in the process. Make sure you understand what your injury is. Get a diagnosis. Being told you have weak glutes, that's why you're injured, is not a diagnosis. That's a finding to get things kind of working. Physical therapists love to just go and say, oh, it's your glutes that are kind of weak. That's why you have back pain. It's why you have knee pain. It's a throwaway comment, and it's one indicative finding. It's not the actual diagnosis. You need to know
Yeah.
what tissue is irritated. Don't use that as a label for yourself, but make sure you understand, okay, that's the tissue. What does it actually mean? What's the natural course of this treatment? Make sure you're asking questions. Be active. A lot of the physical therapists love to be kind of asked questions about what's happening, because it makes them actually check they actually understand it. If they're just going off a recipe in their head, they're not looking at you and modifying things to make sure it's working for you. It might not be adequate treatment to work through things. So make sure you are being active and being really kind of positive about the outcome.
Yeah. Those are great insights, and yeah, I really appreciate you sharing all of your experience, Mark. It's been a real pleasure to speak with you. Thank you for all your time and valuable information.
Thank you, Les.